So welcome everybody. Hello. This is our second, what month is this? February, second webinar of the year. My name is Susan Blacker, and I'm one of the directors on the board of directors. And this is a webinar on Every Nurse is an Addiction Nurse Gets Certified. Our two presenters are Tony Primus, who's a certified addictions registered nurse, a CARN, and has worked in the field of substance use disorders, maternal child health, and pediatrics for over 20 years. Her experience has been in substance use disorder treatments, including MAT, inpatient, outpatient rehab, and maternal child health. She is most proud of her work in the field of substance use disorders and maternal child health. She's a member of Sigma Theta Tau Nu Eta chapter and the American Society of Addiction Nursing. Board appointments to Addiction Nursing Certification Board, the Cumberland County Mental Health and Addictions Board. She's got a state appointment to the New Jersey Maternal Mortality Review Committee. And she has presented nationally on numerous topics related to substance use disorder and also published various journal articles. She graduated from Rowan University, Bachelor of Science, Drexel University, Master of Science, and is currently pursuing a postmaster's doctorate in nursing at the University of Pennsylvania. Our other presenter is Rosemary Smenkowski. She's also a certified addictions nurse and a psych mental health nurse practitioner. Her experience includes fetal alcohol reduction, FDA study drug coordinator for LAM, methadone maintenance and detoxification. She has served as director of nursing for Therapeutic Community and Freestanding Detox Center in New Jersey. Rosemary has facilitated peer assistance meetings for RAMP, New Jersey Alternative to Discipline Program, and is currently appointed to the RAMP Oversight Committee. She's employed as an adjunct professor at Georgian Court University and Monmouth University in New Jersey, educating pre-licensure and graduate nursing students on psychiatry and evidence-based mental health. Rosemary is employed as a psych mental health nurse practitioner at New Hope Integrated Behavioral Health in Marlborough, New Jersey. She's a member of numerous nursing organizations. She serves as president of the Addiction Nursing Certification Board forever. Rosemary presents nationally on the role of nursing in treating substance use disorders and the importance of certification in this specialty. Rosemary promotes nursing as a profession and addiction nursing as a specialty and believes nurses are our untapped resource in combating the disease of addiction. This webinar has been approved for one nursing CE through the California Board of Nursing. You need to complete the survey, which will be sent to you at the completion of the webinar. And then a certificate of completion with the CE will be sent by email with verification that the survey has been completed. If you missed a session, all sessions are recorded and are archived on the website. And if you watch the archive, you can also receive a CE and receive your certificate after completing the survey. All webinars are free to ASAN members. Please keep your cameras on and mute your microphones. If you have questions during the presentation, please put them in the chat and we'll address them at the end of the presentation. And just to let you know that next month our webinar is March 15th at 7 p.m. and Peggy Compton will be presenting on caring about pain in patients with substance use disorder. And Peggy is an expert in pain and substance use disorders. Opioid use disorder. And in April 19th, Bill Carrick, our former president, will be presenting on home detox, what's it all about? And again, please post your questions in the chat box and we will get to them at the end. Today's webinar, Every Nurse is an Addiction Nurse Gets Certified. Tony Primus and Rosemary Smenkowski are the presenters. The learning objectives are to identify the unique role of nursing in the care of persons with substance use disorders, to understand the value of certification, and to summarize the CARN and CARN AP certification process.
Hi, everyone. It's great to be here tonight, actually. Rosemary and I do this presentation, and typically we love to engage the audience as well. I just want you to take a minute and think about a patient that you cared for that had substance use disorder or suspected substance use disorder. And if you could put in the chat where your specialty is and how you came in contact with that patient, how that patient made you feel, or what you did to help facilitate treatment for that patient, we would appreciate it, and we'll save that for the end to talk about. You want to advance?
Sure.
Okay, great. This is great. And I think Rosemary found this actually.
Yeah.
It's a great schematic, and it kind of tells you we're looking recovery coach, addiction counselor, addiction medicine physician, addiction psychologist, addiction psychiatrist, and sponsor. But this is the recovery team. But what is missing? Nurses. And nurses are everywhere on numerous teams, but nurses are definitely everywhere when it comes to substance use disorder and treatment. We are one of the unique fields that actually reach a continuum of patients. And which slide are we on? Okay. Nursing was voted again as one of the trusted, most trusted professions in the Gallup poll for 2022. I think that is 21 years that we have been voted one of the most trusted professions. Also, nursing's art and science and is a holistic care of patients, which is unique to our particular field. We treat the bio, psycho, social, and spiritual aspects of all patients. And we care for patients across the lifespan, which is unique, I think, to our field. We care for the very young, we care for the very old, and we care for the in-between. And we work across all treatment settings, we work in the emergency department, we work in the mental health field, maternal child health, pediatrics, trauma. So we can have a perspective from many different ways in seeing the patient as a whole. Okay. So
let me know when you want me to jump in, because we didn't discuss this.
Okay. No, I think you're on accreditation. A few more slides. I let you do the hard stuff. Nursing defined, and this is from the ANA. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. You can advance. This is actually from our colleagues, actually from the scope and standards of practice, and their definition of addictions nursing is the protection and promotion and optimization of health and abilities for individuals, families, communities, and populations affected by alcohol, tobacco, and other drug use, and persistent and recurrent maladaptive behaviors. Addictions nursing spans the continuum of substance use and behaviors that can become persistent and maladaptive, leading to substance use and addictive disorders. This speaks to the specialized knowledge that addiction nurses hold, and it's taken from the standards, the scope and standards of practice. And it says, it speaks to addictions nurses utilize a holistic framework, recognizing the biological, psychological, social, and spiritual factors associated with and affected by substance use and related maladaptive disorders. And it goes on to say that the framework provides an integral approach to substance use and addictive disorders consistent with complex interactions that occur within the body, brain, mind, emotions, spirit, and environment. I think that this is such a powerful statement, and I never really noticed it before, but it says, despite the decades of research related to neurobiological underpinnings of addiction, a moral paradigm persists. And that moral paradigm actually persists today, these years later. And it says, addictions nurses challenge negative attitudes and beliefs about addictions through the dissemination of evidence-based knowledge to current and future nurses and other healthcare providers, patients, and the public. So we are actually a representative for our profession in addictions nursing. The value of certification, I can't say enough about the value. The certification is defined by the American Board of Nursing Specialties, and it states that it's a formal recognition of specialized knowledge, skills, and experience demonstrated by achievement of standards identified by a nursing specialty to promote optimal health outcomes. And some of the values of certification are that they elevate the standard of addiction nursing practice. They provide expanded career opportunities and advancement, and they benefit you as the nurse through our profession and the public that we serve. This perceived value to self, I looked over that, and there's so many things, and you guys can read them, and I'll just point out a couple. One was the greater earning potential. A lot of organizations consider incentives for certified nurses, and they may give you a little boost in your salary, or also you may be able to, that's a good bargaining chip when you go to negotiate salary. A certification is always a good thing to have. And commitment to professionalism. It shows that you have a commitment to professionalism and that you value the certification that you have. Oh, okay, this one.
Yeah.
A value to others of certification would be that nurse managers expressed a preference for hiring certified nurses because it proves that you have a knowledge base and documented experience in the given specialty that you have. Ours happens to be addiction nurses. The last thing I wanted to say about that, I think if you could go back to the last slide.
Good idea here. Go for it.
No, I don't think so.
No.
Thomas Jefferson. Anyway, I'll tell
There it is.
a lot
Right
of,
here.
a lot of facilities will assist in removing barriers to certification. And we use Thomas Jefferson and Jefferson Health in Philadelphia as examples. But a lot of the hospitals are now offering that with tuition assistance or payment to sit for the exam. And Rosemary will talk about a little bit later some of the scholarships that ANCP actually offers to assist with that as well. And that was my last part, Rosemary.
That's it.
You're up.
Okay. So accreditation. Accreditation is a peer review mechanism that allows nursing certification organizations to obtain accreditation by demonstrating compliance with the highest quality standards available in the industry. Anyone can write a certification test. Not all certification tests are accredited. For many years, our exam was not accredited by, we have ABSNC. We have worked very hard to meet every criterion standard so that when you do go to your hospitals or to your organizations, this does count for magnet status so that your hospitals will offer to pay for your exam if they're offering for certification. Prior to this accreditation, and when it was just certified, you were not allowed to, they didn't count us as a nurse that was certified at the hospital. Okay. So we are accredited since October of 2018, and we have just submitted for reaccreditation. Our accreditation was for 5 years, which we were very proud of because that was the most amount we could get the first time around. And ABSNC is our accrediting organization. Many of you are familiar with ANCC. These are just two different nursing accrediting boards. Okay. The development of the exam is pretty intricate. We get a lot of questions about the exam and how to study for it and those kind of, things, which I'm going to go into and hopefully point you to some evidence-based study guides, so to speak. As part of ANCB's board, we are not allowed to actually give you study materials, so to speak, but we can guide you in the right direction. So the first thing that happens here is we develop a blueprint, which is based on what our nurses are doing in the country. We certify nurses in the United States and Canada. And so we have to have a very broad brush of the questions that are on the exam, which means that although, in vogue right now is fentanyl and opiates, when you sit for this exam, you have to take into consideration process addictions, eating disorders, gambling. There's just more to it in this broad brush. And we all know, you can work. I live in New Jersey. When I meet with patients, there's a big difference even between North Jersey and South Jersey on what they call meds, what the drug of choice is. So we have to be very careful about this broad brush. So our board and our item writers for our exams come from across the country. And actually ABSNC mandates that. So broad brush, New Jersey, California, Canada. The reason why we can, the reason why we can certify Canada is because they take our NCLEX. I don't know if any of you realize that. So we do have item writers and item writer reviews, and every single question has to have a rationale. We work with our testing company, CNET, who helps us make sure that the questions are valid and reliable. We have 2 different exams, CORN and CORN AP for advanced practice, which I'll go into. We recently did our Angoff score, which shows what the cutoff is for passing. So for me, being in this role, I get a lot of people emailing me, telling me I missed by 1 point. I missed by 1 whatever. You sort of don't miss by 1 point because the cutoff is a %. So, that's like the good news, bad news. People get down on themselves if they weren't successful, but our pass rate is very good. And I don't know if I have to see if I have the statistics on that for you, because people like to know that. I might have put it in here. So practice analysis, again, we have to find out what addiction nurses are doing across the country. And that becomes very interesting because many times we have people apply for certification that don't work in hospitals, don't work in treatment facilities. They work in the emergency room. They work in ICU. Some of them work as drug reps, and they do like drug urine screening sales for as a pharmaceutical for doctors, but they know addiction and they know how to explain what happens with that test, and that counts as addiction nursing. Okay, so many different ways that you can be an addictions nurse without ever working, in a hospital or in a treatment facility. Education, okay. So this is based on CORN, but CORN AP follows the same kind of a cycle here. And this is how we get to having an exam. And then this, if I was anyone who was going to take an exam for anything, any accreditation, the first thing I would want to do is look at the blueprint for the exam. So this is for certified addiction registered nurse. This was like redeveloped not that long ago. We changed it because we followed what we felt were most important to go on to the exam. And this will tell you how many questions on each topic exist, okay? And the percent of the total. So this is on our website, which I'm going to take you to before the end of this little presentation so that you can see exactly what we have available for you, okay? All right, this over here would be the CORN advanced practice. The funny thing was when the item writers and the blueprint and exam was compiled, we separated CORN and CORN AP to see what the nurses thought were most important for each exam. And they basically came out to the same thing, except that CORN advanced practice had more focus on pharmacology. But other than that, opiate, alcohol, stimulant, co-occurring psychiatric, comorbid medical conditions, other disorders, prescription drugs, inhalants, tobacco use, cannabis use, they all fit, okay? Let's see. So practice analysis and role delineation study. The purpose is to provide evidence to support the validity of the CORN and CORN AP exam. What are nurses doing? What kind of information is important for them to show that they have competency in? Evidence collected helps ensure the exam reflects current practices, legally defensible, and psychometrically sound, okay? Because if we're saying that you're certified with this credential, we have to know that you actually know what you're talking, like they can come back to us. So our board has insurance, we're responsible for validating your knowledge as far as the credential is concerned. So for those of you who may be considering CORN, RN licensed, full, unrestricted in the United States and its territories and Canada. So that would be Puerto Rico, American Samoa. We do have one nurse who's certified in New Zealand. She kind of took her test in United States a long time ago, and she resorts every year, and she's still like an outlier in New Zealand, okay? Non-US or Canadian nurses meeting the criteria for CORN examination must submit evidence of equivalent licensure as an RN in the United States or provide evaluation from the Commission on Graduates of Foreign Nursing Students. So do we say that we don't certify people not in the United States? Not really. As long as you can prove that you can have your license equal to that of the United States, that's consideration for sitting for the exam. We got into a bit of a conundrum, so to speak, when because of international nurses wanting to be CORN. The idea of ANCB at the time, certifying nurses in other languages and other cultures, I just explained to you, even across the country, we have differences. So it would be the same exam that somebody would be taking from another country and coming here if their license actually and their education met the criteria of US RN nursing. So clinical experience, verified documentation of 2,000 hours, which is 1 year of full-time work of nursing experience related to addictions nursing, staff, administrative, teaching, okay, within 3 years before the application and verified and signed by a direct supervisor. And I'm going to talk to you a little bit about how we've broadened that with the CORN advanced practice, and I'll tell you why. Continuing education contact hours, 30 related to addiction nursing and acquired within 3 years prior to the application, okay? RN licensed candidates must provide evidence. This is CORN AP RN licensed candidates must provide evidence that they hold a current, full, unrestricted license. Now, the asterisk here is because we do have a policy for nurses who are in alternative to discipline programs. If ANCB recognizes the worth of nurses in recovery and what they can do in our field. And so we have a clause that if you're in an alternative to discipline program and you can have a letter from the administrator of your program that you are in full compliance, you can sit for the exam, okay? As a registered nurse in the United States, its territory is Canada. Non-US nurses or Canadian nurses, again, can apply for advanced practice. And they must submit evidence, again, of equivalent licensure as an RN in the US or provide evaluation from the Commission on Graduates of Foreign Nursing Students or the World Education Service, okay? Candidates must hold a master's degree or higher in nursing, verification of 500 clinical hours in advanced clinical practice obtained within the past 4 years, and this may be earned in a master's or postmaster's program. Now, here's where there's a little bit of questionable. When APRN status for prescriptive authority became more prominent, we found that many of the nurses that take the current AP are APRNs and are looking for or have prescriptive privileges. Our criteria for APR for advanced practice is not APRN. And initially we thought we might have to change this to current APRN, but we're not really saying that anybody is prescriptive. We're saying you're advanced practice. So this is a nurse who has a master's or higher, regardless of whether you're a nurse practitioner, as long as it's nursing degree. Okay, so it has to be clear. We had to be sure we weren't being deceptive with AP, but ABSNC assures us we're not, because we're not saying APRN. So we do have nurses with masters that are not nurse practitioners that are current AP, all right? Okay, and that's important. So, master's program, applicant must attach a transcript highlighting all itemized experience hours for submission, and the hours must be addiction or dual diagnosis within 4 years, okay, from your program. Postmaster's program, applicant must attach verification form completed by a direct supervisor. The verification form may be copied and distributed to multiple supervisors if needing. But if you had a preceptor that you were working with, but you had like 4 or 5, I mean, I did my, advanced practice. I had like 6 supervisors, right? That my So also needed is verification of 1,500 hours of nursing experience in addiction as an advanced practice APN, okay, within the last 3 years before the application. Hours may be administrative, teaching, private practice, consultation, counseling, research capacity. So you can see that being a prescriber is not needed for many of these. And so advanced practice would be the credential you would go for, whether or not you prescribed, as long as you had a master's or higher in nursing. Contact hours are 45 hours of approved nursing education in addictions within 3 years before the application submission. 51% of the hours must be addiction nursing specific. The remaining hours can be related to addiction, which would be HIV/AIDS, hepatitis, pain management. I mean, there's a whole group of things that could go with that. So, important, formal course credit, equivalency measurements by hours of lecture time per week. 1 academic semester credit equals 15 points of credit. 1 academic quarter credit equals 10 points of credit. And this is the same as ANCC, if any of you are certified in any other field. So for initial certification by examination, continuing education contact hours include online, on-campus coursework, conferences, and lectures where the applicant is the learner. And that's important because if you're a presenter or giving the lectures, they aren't considered. That you can use those for recertification, but not for certification. And I hope if you have questions, you're kind of writing them down or chatting, because I think this is important for you to know. Many times we get people that did presentations and they're very proud of them. And I'm sure they're great, but we really can't put our like imprimatur, so to speak, on it without, saying that they're already certified. Supervisor signature. This is very important also. Postmaster's consultation supervision provided by a professional with addiction experience. Supervision may be in person or virtual. This is brand new. In fact, this happened within the last 2 weeks, because I'm lucky enough that I meet nurses from all over the country, and we got a call from a professor in North Dakota who told me that, this was the premier certification for addiction, really the only one, right, that's recognized by American Nurse Association. And they only had 2 certified nurses in all of North Dakota, and they were CARNs, not even CARN AP. And he happens to work at the University of North Dakota and was charged with developing a program. We went into a little bit of a battle because we only allow 40 CEs from the masters. The other 5 credits have to be from someplace else, because we don't want one vision. And it can't be, like I said, just, opiates. It's got to be a broad brush. So he said to me, who am I going to get to supervise nurses in addiction when there aren't any here? So how do you reach rural areas? So the board got together, and we now have a policy that nurses can be supervised virtually, as long as the people who are doing this, certification here, supervision, are certified and meet criteria, as in addictions nurse specialists with an MSN or higher for CARN and CARN AP, master's prepared licensed certified mental health social worker, psychiatrist, psychologist prepared at the doctoral level and listed in the National Registry of Health Service Providers, psychologist prepared at doctoral level in American Psychiatric Accredited Program in one of the following areas: clinical psychology, counseling, psychology, or school psychology. So what is the deal? We're really hoping that A, this professor gets his program up and running, and that would be great. And B, that other educators will contact us, because we want people in rural areas to be, to be able to get certified. About 3 years ago, we had a board member who was from South Dakota, and there are only 2 nurses in South Dakota that were certified. But we had to expand, and thank goodness for people who were forward thinking. And this gentleman brought it to our attention. We met with him, and we're really hoping that this is very successful. Tony, you want to do the LPN part?
Sure.
Okay.
Rosemary and I have always, actually, we are both LPNs.
In heart, yeah.
Yeah. We started as LPNs and, returned to school to get our education, to further our education. Practical nurse education and preparation for successfully passing the National Council licensure examination for practical nurses can be completed in approximately 1 year. As we know, I think it's a little bit longer than that, maybe 18 months. I know mine was. I don't know about others. And this licensure regulates the nurse's practice and promotes better outcomes for patients and other recipients of healthcare. We know, we all know that LPNs or LVNs, in some states they're called LVNs, play a significant role in the healthcare environment, and they are the staple of healthcare. And no more than in the field of substance use disorder. They play a huge role in substance use disorder outpatient clinics, and actually inpatient as well. And we are trying to pull some things together. Rosemary and I have been working on hopefully getting a certificate similar to the certification that we have for registered nurses for CARN and CARN AP. But we need to have more conversation and need to have a better pathway, I think, to be able to do that. But certainly on our radar.
And on the board's radar, except it's very hard because it would have to be a certificate, not a certification. We wouldn't be able to get accredited in that way. And because across the country, LPN's, scope of practice is so varied. I can tell you that knowing what the exam is like, I work with many LPNs in the inpatient facility I work at. They could pass that exam in a heartbeat. They really could. But many of them are all working out of the scope of their practice, and that's the truth. So we have to find a way to meet with LPN leadership because, again, we would need a role delineation study of where LPNs are working and what they're doing in addiction in order to be able to have an exam that's evidence-based, valid, right, and reliable as to what the skills are that they need competency in. So it's a little bit bigger than a bread box. I could tell you, I love being an LPN. After I got my RN, I contacted ANCB at the time because I wanted to sit for my RN. I wanted to sit for a CARN, and I was told I had to work for 3 years as a RN, in this field. So it was 3 years later that I sat. So I get the how it makes you feel when you feel like you've worked so hard to do something. But that's kind of beyond us. But role delineation study is something we would need. They're not cheap to come by, and you need a lot of people to be able to have input into them from all over the country. Okay, so we're not negating LPNs in any way. I value them. They're my people. And, it's just that our hands are tied with this. However, if people have connections and, LPN leadership that would like to meet with us, I'd be more than happy to meet with them at any time. Okay.
We would love to do that because we feel like it's such an important part of addictions medicine that really no one pays attention to, but they're the foundation.
Absolutely.
in a lot of the inpatient and outpatient treatment centers. So
and LPNs are very happy in their role. Not everybody that's an LPN wants to be an RN. They are bedside nurses. They do their job well, and that's respected. So we would love to have that conversation. So there are 2 scholarships: the Carolyn Jewell Still Magnolia Scholarship, which is funded by ANCB, and the ANCB Member Scholarship, which is funded by Elizabeth Biles, who was kind enough to donate these 2 scholarships right now are being advertised for. And it has to do with having a letter of recommendation and writing in a document why you think you want to be a certified addiction registered nurse. I invite anyone on this call who's not certified to apply to advisory ANCB, send a letter and why you want to become an addictions nurse, and have your supervisor or somebody just write a letter of recommendation for you. We're more than happy. We would love to award both of these, and they usually are awarded in October. Okay. So this is, I don't know, my computer's crazy tonight. On our website, you'll see this. This is our map of the United States, which shows where all of our nurses are located at. And you can see each state has a number of how many nurses are in there. I would love to hit Wyoming and Nevada. I mean, do you see what this is going on here? You'll tend to see that we're very congested in the East Coast over here. And unfortunately, most of our board members are down this East Coast. And I think that we're so passionate about what we do. We kind of spread the word and people get certified, but we really need more people across this country to be certified in addictions. And I have some great information for you at the end of this. So here's the current number of certified nurses. I can tell you that when I started, the numbers were like 700. And I'm talking about while I was president. So it's not that, I think I don't know how many years I've been president. I don't even want to think, but in October, I'll be finished. So right now there's 892 CARN and 382 advanced practice for a total of 1,274, which for people who are on this call that know me and know Susan Blacker, who's foundational in getting these numbers lifted, and everybody, Carolyn, everybody, Ginny Coletti, all the people who have worked on ANCB over time knows that these were hard fought numbers. So we're very proud of that, but we need more. And we hope that by doing things like here, moving forward into the future, building collaborative agreements with nursing organizations. We have an MOU right now with the Veterans Administration, NOVA, to offer their nurses a decreased rate to take the exam. It was really weird. I called NOVA and I called corrections nurses because I thought, I was a corrections nurse, right? Who has more addiction than the vets and, corrections? And the leadership had no idea. They hadn't even thought about anything for substance use, which kind of blew my mind. But NOVA agreed, and so we give them a discount. The corrections, because they're so regulated, they have to go through so many levels of chain of command that they're still working on that. Okay. We did outreach to APNA because you can't really treat psychiatry without treating addiction. Also, if you do, you're missing a big piece of this puzzle here, right? They haven't gotten back to me yet, but they did respond, which was interesting. And the other thing we have on the list is we finally have enough questions in our banks for our exams that they're going to have practice exams that they're going to offer, which is great. It was so hard to get items and item writers that were evidence-based, reliable, right, valid, that to have extra questions was almost like something we thought we'd never reach. But over the past year, we've had item writing workshops. We asked nurses who were certified to help with that, and we're doing great. So this is the revised policy for supervision for nurses who can have their use a platform virtually for if anywhere, really. It doesn't have to be in rural, but we just pass it for everybody. We're currently reviewing collaboration with nursing organizations because every year we used to have a face-to-face that was,
with another organization.
And although we did meet face-to-face for item writing and for ANGOF this year, we weren't able to offer the networking and, CEs. And that's something that really is rich. When you're an addictions nurse, going to a conference where we have kindred spirits is like taking a break to Shangri-La or something, because we're always battling and trying to get our points across. So to have that kind of networking, that's great. And to have a table at a conference like that where we can talk to nurses about getting certified, it's just so much more valuable than doing virtual conferences. So a couple of years ago, they went across and asked nurses in addiction what they thought they did. And these were all of their responses. So anybody who is an addictions nurse can see, we believe in success, no matter the size, creative, these are just what nurses felt they did as their job as an addictions nurse, which I think is very powerful. And this is going to take us to our website. However, these are my, right. Okay. So I'm going to just, let's see, hold on one second. I'm going to stop sharing for a minute here.
Right? You go back. I think it might work.
Yeah, I saw it there. Hold on. Yeah. I'm going to just make that small. I'm just going to get that. And, okay, I got it. Okay. So here's what I want to show you. So if you go to our site, which I really hope you do, it was my big plan that you would do that. I hope I can make this. This is extremely important. Okay. This is where you would go under the tab just for education to take the exam. And this would be your office-based addiction treatment training and technical assistance. And of course, it's from Massachusetts. And I can open this up and you can see, can you see this still as I'm doing this? I hope. Yes. Can you see?
Yeah.
Okay. Right. So if you go here with this collaborative approach and you just look down this table of contents, this will give you all the information you need on office-based opiate treatment for nurses. Okay. And actually one of our board members is the spearheader of this and originator, and that's Colleen LaBelle. I can't give her enough credit for that. Okay. The other thing is down here, this is really from ABSNC and ABNS. And if you look at this, it's pretty powerful because this is the importance of specialty nursing. Now, unfortunately, here, 75% of adults think it's important for all nurses required to have a specialty certification, okay? So 2/3 of adults support hospitals requiring their nurses to have a nursing certification in order to be employed at the hospital. And let's see, because there's more, because I want to get to really the big one, but here, this is the ABSNC survey, which is the one that, so over 1 million specialty nurses, right? 44 boards is what they certify, 148 credentials, 53 specialists, credential fast facts, 86% available internationally, 57% magnet accepted, 72% accredited. All right. And here, this is the sad part. This is where psychiatric nurses are listed because they did the top specialty areas, and we don't have addiction nursing there yet. So my hope is that like we're going to get our little name under there for addiction nursing, because in all sincerity, every one of those specialties has substance use disorders within their realm. They just don't identify it. You know it and I know it. Now, this is the most important thing that you can possibly see and take away tonight, except for the fact that I want you to take the exam. These are addiction nursing competencies, which were put out by Massachusetts last year, September of 2021. Who knew? What do you need to be competent as a nurse working in addictions? If you're a professor or you're a director of nursing in a facility, how are you going to prove that your nurses are competent to treat patients with substance use disorder? This document is free and it's available to anybody who goes on this site, and you have direct access from us. So here, this is, I want to get past all of these credentials here to show you just a little idea of what happens here. So this is an introduction, table of foundations and assessment. If I go to the table of contents and just say, I want to do, just say professionalism. And I should go on to professionalism and what patient-centered care, knowledge, skills, supportive education. Okay. Perfect. Perfect. Right. Now, what if I want to go a little bit further and I want to see what the rationales are and where is it going to take me? Each one of these is hyperlinked to these here. De-escalation, agitated patient. Now, this would be the tool that you're going to rate or assess your nurse or yourself on whether or not you meet this competency. This is for every single, look here, safety, every single topic you can possibly imagine as an addiction nurse. Opioid overdose referral here. Understand Good Samaritan law in your state as if it protects people calling 911. I mean, any single nuance that you think you need, okay, to educate your nurses, this is free with here hyperlinks to anything that will make sense to you so that you have a rationale. And this is absolutely free. So, we always had the scope and standards, okay? But that doesn't tell you what competencies you need to be an addictions nurse, like what you're going. This document does. Now, the document is so new and apparently so underused, oh, by the way, that when the authors of this, tried to turn it into, they didn't even come up. So when you're going to do addiction nursing competencies and you're going to see what's going to come up so you don't play, there isn't anything that's going to come up. This document, it's worth its weight in gold for anybody who's teaching addiction nursing, whether it's in a classroom or in your facility if you're a director of nursing, okay? And this is on our site, which is right here, ANCB, and you can see, so if you go to this is examination, recertification, these are the statistics, pass rates, ANGOF rates, this is education, and then our nurse directory. So if you're somebody who's living in a state where you want to see if there's an addictions nurse, you can go on this directory and they will give you an email. They will, as long as you're a member, you can access that, okay? And this is about our scholarships. And I just feel like, to me, having competencies that we can actually make sure that everyone is on the same page with what we do is something that addiction nursing has needed for a very, very long time. Is everybody still awake? Yes, I don't know. How about questions?
Yeah, Rosemary, I saw a question in the chat about scholarships, and I think you told them about the link in the on the
Yeah.
web.
Also, we're in a, I'm so glad to be here. Like, I mean, I'll talk to anybody about this. I don't, I really will. I've done schools, like student nursing associations. The problem with addiction nursing is, how can anybody want to be one when they don't really see what we do? I mean, you want to be an OB nurse, everybody knows what they do. You want to be an ER nurse, oh my God, turn on channel 7. All right. So for us, psychiatry and addiction, they really don't know what we do until they can see us. And like for me, I teach, I teach the master's program for psych mental health at one school, and the other one I teach undergrad. The undergrad's like, no, they don't want to. They want to go into plastics. You know what I mean? This is what they're doing, right? Botox. That's what they're doing now. It's an amazing thing. But the master's program, I feel like that they challenge me, and they're great, and they're already, centered into here. But even then, if I ask my class, how'd you wind up here? It was usually something personal, But we need to get the people from all the other fields that we already know have our patients. That, like when Tony said to you, think of a time that you took, when Tony and I do this presentation, like we did at the National League for Nursing conference, right, in Atlantic City. They weren't addiction nurses. They weren't psychiatric nurses. And they're thinking, oh my God, like the last time I had a patient with a substance use disorder, it was a disaster. We didn't meet the needs of that patient at all. Or that one picture that you saw, the bracelet that said opioids on it for allergy, that is the epitome of nursing art and science, because that was a patient that was in the emergency room who told a nurse they were in recovery and did not want opiates unless they absolutely needed it. So the only way the nurse felt that they could intervene for this patient if the nurse was off duty was to put that they were allergic to opioids so that they'd have the conversation. Like, these are the kind of things we need to do. You can see I'm like a Tupperware lady with plastic, right? Tony does better than me. I get carried away. But any questions? No. What else out in the box?
No, a lot of people put their questions in the chat, or they shared some of the, like Samantha, she's a clinical coordinator for an outpatient substance use disorder clinic. And
but
she said that
being a clinical coordinator in an outpatient substance use facility, having these competencies is like a beautiful thing for you. I mean, you can pick and choose what you need, but in all sincerity, this foundational stuff is something our field has been looking for and needed. Right?
And Cece, she's in critical care.
Critical care.
Mm-hmm.
Who's the person from critical care? Where are you?
Cece. Cat.
I'm not prepared to turn my camera on, but I'm here.
That's okay. So tell me about a situation. Tell me, like, because you know what, if you're in critical care, I'm in a doctoral program, right? Okay. So, and believe me, it's like, it's a labor of love that I should have, it's a lot of work, right? To all of you doctors out there, and I know most of you are my friends that have a doctorate, it's really a lot of work. But I'm in a class with people who are absolutely brilliant nurses, right? And they thank me for working with those people. And, we all have the same page, and they're doctoral candidates. It's so great, Rosemary, that you work with those people. Isn't that wonderful? I said, so do you. We share.
Yeah. So, Cece, do you work with, I'm sorry if that's not your name, that's what comes up on the.
It is Cece, that's correct.
Okay. Do you think that you have people in critical care that are?
Oh, absolutely.
Okay.
Yeah, I did travel nursing for a while, and a lot of urban and rural areas that I worked in. Both, just almost all of my patients had some level of substance use issues. And it's really hard to send them, out of the ICU setting, and you're glad that their really intensive medical needs are taken care of, but that they're probably going to end up back there in a couple months.
Right. Right. And the sad thing is medicine really doesn't do a good job with addiction, but I'm doing like my practicum in inpatient psychiatry, and psychiatry doesn't do a good job with people with substance use disorders. And the emergency room has no time for patients with substance use disorders.
No, but some hospitals now have addiction medicine teams. I didn't know if your
Well,
hospital.
they do, but I'll tell you, I was actually on grand rounds today, and in New Jersey, there aren't any. I mean, they have,
Cooper has one.
Cooper does, but they're I know because I met the physician from there, but it's very rare. I know Massachusetts does. I know a place in New England does, but to actually have someone that will even what they were talking about actually was boarding in the emergency room when you don't have a for somebody, and what are you going to do with somebody who's coming off, like really going into withdrawal and has a psychiatric disorder. And most of the hospitals are not prepared for that. They don't have a bed for them. What do they do in the ED with them? It's very poor. But that's why we need nurses to get certified in addiction. It gives you a voice, it gives you credibility, and it should give you a voice. And I'm saying, but
this is a local who's Ashia? Asia? Asia.
Hi.
I'm sorry, Asia.
Everyone does it. You'd be surprised when people get it right. It's so easy.
So that's a local magnet hospital. How do they feel about addictions medicine?
So it's interesting. I would say they have a couple offshoots for like outpatient services for addiction, but I would say that department. So I was kind of a fill-in for that department while I was also doing mental health assessments for psychiatry in the emergency room.
Right.
And so we did a combination of things. And so people who wanted to kind of have those experiences that have the history and the work experience behind behavioral health and substance use disorder were able to opt into this small department of literally 3 people. So you could fill in that capacity, and we would go around and make rounds to people who were high risk for aggression related to substance withdrawal. And we would actually work hand in hand with the providers and doctors to help manage, whether it's medically, whether it's, non-pharmaceutical ways to manage withdrawal. And we actually provided them with suggestions, whether it was medication or whether it was other means, to help treat each client or each patient individually and their current symptoms of withdrawal and predicting that likelihood of when they will start withdrawal and how things will go based on their medical and psychiatric history and substance use history.
But where are you guys from statewise? Or any of you from?
I'm in Minnesota. So I'm in central Minnesota. Yep. And I would say that our local hospital is pretty well known in central Minnesota. It's not as big as like the Mayo, but we're up there. We're close to that as well.
Yeah. So how many of you
person works with me as well?
How is that making an impact on your readmission rate?
It's interesting because those folks typically are on the medical floors. And so they're not necessarily what happens is they're medically stabilized, and then they either transfer to our like adult mental health unit, or they transfer to our outpatient substance use programs, things like that. I will say, I think from time to time, it absolutely makes a difference. I was at that hospital for roughly 5 or 6 years. So it wasn't a ton of time in that department because I had already worked at the hospital for a couple of years before I entered that department. But I do think it definitely impacts things. We can catch things early as soon as the ER, and we can really jump on that. So we get flagged, our team gets flagged anytime someone hits the emergency room or urgent care, and with the intent to be admitted. And a lot of times too, we were asked to consult with patients in the ER that were planning for discharge right from the emergency room. So we could set them up with services prior to them leaving, and the likelihood of them attending those appointments and those follow-ups were higher than if they didn't have those in their back pocket when they left the ER.
Oh, that's
So-
great work. That's great work.
So the other thing is, the more people who get certified in addiction nursing, the more the language changes also, because our patients don't get treated so well on med-surg, but not, they're just not, there's different language that's there. There's, some of them dread.
We're also in the emergency room.
Right, exactly.
Yeah.
In fact, I had a patient who was a neurosurgeon. This is a true story. He, bad night, fell asleep at his car. And I work in a facility that's mostly state insurance. And the police brought him to the hospital that he practiced at, which I thought was really horrible. I said, how'd that happen? And he said, I woke up in the ED. He said, I was asleep at the wheel, so I don't know. I said, how'd they treat you? He said, horrible, until they found out I was a physician. I mean, and that's coming from a doctor who's, you know what I mean? So we have to change the language. And I think as you're more educated in the disease, and as we can educate other people, the language matters to get people to get treatment. Yeah, I do. But I think Susan probably wants to cut us off here because it's 8
Yeah. Can you
Sorry,
hear me?
Susan.
That's okay. We had a really good discussion going and I didn't want to interrupt, but it is after 8.
8:05.
So, I mean, we could talk, I know we could talk for hours and hours, but we need to let people go. When you sign off, you'll be getting a survey in the email that you need to complete. And then when you complete your survey, you'll get another email with your certificate and your CE. So thank you,
If anybody-
Rosemary and Tony. It was really
Rose-
excellent. I learned a lot and I've been certified.
Did you really?
since 2006.
wow.
So
She's been my person. But if you need to get in touch with any of us, if you go to the site under the board, all of our personal emails are there. So you can either contact ANCB or you can email any one of us. Thank you so much for coming. I appreciate you guys. Spread the word. Okay.
Thank you.